This is our October series or October session. I think we have one more to the end of the year, but we are grateful that you've been able to join us for this session. I see we have 13 people online, and we see a good combination of colleagues from the US, Asia, and Africa. I think because of time, we will start. And I know I've just sent a reminder on email for everyone to join us. So I know people will be joining us even as we continue. So I want to hand over to Karen. Karen, I think you've done this before with us as global communicators. Karen is a filmmaker and an astute photographer. And I know we have lots to learn from you and also share together today. So I'll hand over to you, Karen. Over to you.
Hi, everyone. I'm actually a filmmaker by accident. I'm not really a filmmaker. I'm actually a still photographer, but I did produce a film about my own mother with 2 other colleagues called Japanese War Brides Fall Down 7, Get Up 8, and that got licensed by BBC and we won a ton of awards. So I guess the bottom line is if you're passionate and interested in something, these are just tools that you use and you really need to be able to tell a story. So anyway, I'm going to go ahead and start because I wasn't sure who was online. I'm not sure what your level is in terms of photography or whatever. So I'm going ahead and give this talk that I kind of craft for Japago. At the end, feel free to ask questions, whatever you want to do. If I'm not clear on a point, feel free to, ask me about it later. But I'm going to go ahead and start. But Joan or someone, can you make sure we were having some technical issues yesterday? So Can we make sure that we are actually at the correct screen? It should be just one screen. Let me just go ahead and go this. Okay, so do you just see the screen that just says look first to see the photos before you want to? Can you see that?
We can see that. Yes, we can.
Okay, so let me put this way at the bottom here. Okay, so we're going to go ahead and start then. So we're in this world where all these technical advances, especially with smartphones and even with the digital cameras, makes photography seem easy to do. It just seems like, oh, all you do is pick up and point, right? And that we don't, and actually, truthfully, we don't have to worry about the so-called craft of photography anymore because the camera is very smart, the phone is very smart. But the ease of this technology kind of masks the fact that good storytelling, good photography actually belongs in the mind of the person who is holding that camera. It is not a technical tool that makes photography. It is you yourself, what you're thinking about and what's going on in your brain. Now let's see what we got. Oh, there it goes. Okay, there. So oftentimes as communicators, we need to understand that what we see, what the human eye see or what the brain actually sees is often not the way that the camera sees. The camera is unforgiving. It picks up everything. And so what professional photographers like myself do is we're trying to get the camera to record what we want to say about a scene. So because of the advances in smartphones and such, exposure is taken care of. Things like, lighting is just things you just worry about, later. But just because you can take a good image does not mean that it's good. I mean, just because you can take a nicely nicely exposed image, I should say, because that's what cell phones do, doesn't mean that the image is actually good or usable or that it even reflects what you want to say about it. To see photographically, you have to make sure that the camera or the phone is taking only what you want it to see. And also part of this is to also understand what it is that you want to show and what it is that you want to tell your viewer. So who is your audience? And that's something you have to be always aware of. There are 3 main tools to create good photography. You only need to understand these 3 things and you'll produce good images. That's composition, timing, and light. I could do an entire workshop on all 3 of these things individually. I have done that. You can go pretty deep into all 3 of these topics. But for this talk, I'm only going to discuss composition and timing because those are the things that we have the most control over, especially if you're holding a smartphone. So This is where one needs to, composition is placing the elements within a picture. Sorry about that, I'm gonna take this. It's 8 o'clock in the morning, it's a little too early for me. So composition is when you look through the lens and you want the lens or the camera to take what you see. Just by grabbing a image or recording an event often leads to a picture that is not well composed, hard to read, and unclear about what the message is taking or what the message is that you want to say. And this is where you get these pictures where people have their arms coming out of someone's head. You got, you got people walking, part of their faces in the frame, all these kind of things. These are times when people are just photographed or just taking the picture, or I would say recording the picture, but not really looking at the composition. They're not really looking through the frame. There's a bunch of compositional elements. This is just a handful of them. There's dozens of others. Framing, leading lines, some of the foreground, rule of thirds, all those things are things that are just tools that you can use to try to improve your compositional view or compositional eye. The problem too is that you have to practice these. Just because you know them doesn't mean anything. You actually have to practice them. And this is where many people fall down, because they actually are what I call recording a scene. They're lifting up their camera, grabbing a few shots, and then walking away. They are not taking the photograph. And there's a big difference between these two approaches. When I'm seeing an image like this, I am waiting to make sure that most of the people's faces are seen, that the one that is about to get vaccinated is actually looking at the vaccinator. The vaccinator is looking at the vial that she is holding. And only when all these elements come together, I actually take the photo. And I only have like maybe 3 images of this after actually standing around for 5 to 10 minutes watching this whole scene. Recording a scene means you would just grab it and walk away. And I've seen that all the time. People pick up their iPhones, they take a picture, and then they walk away. They're not really observing the scene. They're not watching what's going on. They're just trying to record what's there. And so taking a picture or photographing a picture means that you have to wait until all the elements come together before clicking the shutter. Now you can do a bunch of different photos and look at them later, but why put that work on top of you? Anytime you take 10, 15, 20, 30 photos of a situation, you have to edit that down. That takes a lot of work. And so it's better just to get this picture done right before you actually put it into your camera. And so composition can actually help focus an image. This is the same place in Nigeria. The previous picture was taken in northern Nigeria. This is in the same place. These women are gathering in a savings club meeting. The scene is quite chaotic. There's all these women, floating around. But there's certain compositional things that actually work to help us draw it together. The repeat shapes of the women wearing the same outfit gives it sort of a harmony. That's one of the composition tools, repeated shapes. I still had to wait and watch because all these women milling around is still a bit chaotic. So suddenly there's this woman off to the right who lifts the baby up and hands it over to the mother. That is what we would call order and disorder. It's another compositional tool, and it brings your eye to that point, and suddenly the picture comes together as a scene. So those are kind of things that you watch for when you're taking these kind of pictures, because oftentimes we are really in a chaotic situation. Almost, most of the time. A lot of people are milling around. There's a lot of people in the room. And so the key is to watch where you can do a point of focus and then take the picture then. And that will give you sort of a bit of harmonious sort of feel to the picture. This situation was quite interesting. And I think Melinda Gates actually selected one of these pictures for one of her tweets when we, a long time ago, for the foundation, the Gates Foundation. So we're very happy about that. You also don't have to show the entire scene when you're in a situation. I know we often try to do that because we want to see all that's going on. For example, this is a meeting in northern Ethiopia, or somewhere in Ethiopia, I can't remember where. And this woman is watching these men discuss the health direction of the village, including the women's health program. And they're actually meeting in the Women's Health Center. But there's actually 2 pictures here. And this is something, compositionally, this works very well. There are the 3 guys, there's the women in the village looking in. But this picture to me talks about the power structure of the village. It's the men telling the women how to run their own health clinic. But I like this picture better because I feel like this picture emphasizes the strength of the woman. And I took this picture before the men moved into the room. I see it as a portrait of a strong woman in Ethiopia. So it comes, what you choose and what you photograph depends on, what you're thinking about, what is it that you want to say, and also moving yourself around physically in order to take this picture, because sometimes that's what you have to do. You can't just stand in one place. You have to move yourself around. The next few images that I'm going to show you are sort of similar in that case, where I was in a kind of chaotic situation and I had to selectively feel or look at what I wanted to say. And then work that situation. I mean, this is a big bedroom. There was a lot of people in the room behind me. And this young woman was unfolding her bed net. So compositionally, this works pretty well. There's a nice backlight coming in on her, highlighting her. But I also wanted to include the crutches that were against the wall, because when she has to use the crutches to walk, but when she unfolds the bed net, she puts the crutches down or against the wall to start doing it. And this young woman was injured as a child. When she was 2 years old, she stepped in an open fire and that crippled her, burned her foot. And this is very common in rural areas oftentimes. And so I wanted to also kind of include that, even though it's not prominent when we're talking about this photo that talks about the health, the health of a community. And this particular story was about malaria, but with the crutches in there, you could also start talking about accidents that occur to children in these rural areas, the safety factors. This is also Nigeria, but sort of at another time and another shoot. And at this moment, this is a moment that I really like on this woman. She has HIV and her goal is to live long enough to see her baby grow up. So compositionally, she is the dominant figure with her child, even though there's kind of a little bit of chaos in the background, her being in the foreground actually brings the picture together. And I spent the day with her at work. She's a health advisor at one of the local hospitals working with HIV, other people with HIV. And then I went home to photograph her with her baby. We were wanting to do a little story about her. She has a very nice backstory. So I photographed her getting water and grinding meal and feeding this child. She doesn't breastfeed the child because she has HIV. So she bottle feeds the child. But only at the end of this day, actually, this is toward the end of the day that I spent with her, we started talking about her life and her family. And then she actually touched her forehead to her son's and said that her main goal was to live long enough to bring him to adulthood. So this is one moment. I mean, I got one frame exactly of this thing. And so you need time to get these intimate and close-in pictures. You need to make them people need to feel comfortable with you. So they're able to share with you what it is that is important to them in their lives. And so composition is part of the tools that I use to sort of bring a picture like that forward. So here are a few examples of how composition plus light, which I'm not going to go into because I could again spend a whole session on light, makes the message stronger. This is a picture that was sent to me. It's also from Nigeria. Nigeria is a great place to work, actually. I don't know who shot this picture. It's showing a vaccine situation, and there's a lot of distractions here. This picture does not work for me. I would look at it and I can't figure out what's going on. It was a flash on camera. The overexposed nurse's outfit is very distracting, that white thing. The nurse's hand is right in front of the baby's face, so it kind of blocks the face. And the shadows are very distracting. There's shadows on her arm, shadows on the wall, because it's a direct flash. So what's important, it took me a while to realize that the baby was actually getting a polio vaccine, which is the liquid vaccine that's going into the baby's mouth. And so when you have to spend that much time on a photo to look at it, it's not working, because people do not spend that kind of time looking at photos anymore. So I was thinking, like, how could have this been done better? Well, you could have, this was an important picture for you all, I would have moved that baby toward a window side, or, get natural light on it or whatever. Because right now, all that they're doing is just recording this event, and it's really hard to look at. This is a picture I took a couple of years before. It was a similar situation. It was very crowded. It was very busy. But I realized in order to make this picture work, I had to put the emphasis on the vaccination and the child. I didn't need to show the parents. I just needed to show, or the head medical worker, but their hands coming toward the child gave it sort of what they call, direct lines that lead to the main subject compositionally. The kid is in the center of the picture. And also I moved to the side so I could see his face clearly and see the vaccination clearly. And so part of composition is moving yourself around in order to get the great shot. And also by looking down on the child, I was able to get a neutral background that was not distracting because we're looking at the ground. So this is just one of the ways to work this kind of vaccination situation. This is a similar picture to the first one that I showed. I don't know where it's taken, nor do I know where it is, who took it, but it's compositionally with the women, it's actually a very good picture. It's the midwife holding the baby down with the mom, I guess. But again, flash on camera just is like jarring. There's the, light shadow on the wall. And then there's these two shelvings behind the midwife, which I guess she's the midwife, which is very distracting. And the shelving is going through the midwife's head. So I'm kind of looking at the shelving, I'm looking at the teacups, I'm looking at everything else, but the real important scene, which is the midwife handing the baby over to the mother. So these are things that you really have to think about when you're trying to take a picture, if you are taking this picture to make a point. So this is a similar image that I did in Bangladesh. Nurse midwife, this is actually a student nurse midwife with a mom and her baby. And again, this was a situation that was not set up. I actually literally walked upon this situation and saw it. I left the group. We were doing a group tour, which was not very interesting, and I kind of left it. And so I went into this room and saw this picture. And the nurse was helping the mom. And this is one of these lucky situations where there's a light coming in from the window. She's backlit. And I just waited and watched until she bent forward and her head was framed inside one of the panels of the window. So oftentimes it's not just composition, but it's also timing, which makes a powerful picture. This picture actually ended up being on a cover of a book on nursing for Emory University. It was a book that was nominated for the Pulitzer Prize. And so this was a very gratuitous sort of find in a way. And oftentimes pictures that work really well are pictures that just happen. They're serendipitous. You can't plan those pictures, but you have to give the photographer time to find those pictures. And that's the big difference oftentimes when you do these kind of photo shoots in your own programming, is that, to try to set something up doesn't always work. Sometimes it's just hanging around watching to see what unfolds. Another thing that can really help with composition is to eliminate unnecessary elements. I think this picture might have been taken in India or Bangladesh. I don't really know. Again, it was sent to me. This has a nice clean background. Compositionally, it's not bad, but the problem is that there's a lot of distraction here. The big blue t-shirt of the health worker, all I can see is the big blue t-shirt, where in reality, the guy is working on the hand of this little baby. And then this very direct stare of this young mother is very disconcerting. I want to just look back at her. So I'm not even, again, looking at the baby, I'm looking at her. And so this is really what's the interesting area. It's the hands. I don't know why they're clipping the nails of the baby, but it's what is going on. So if that's important, then you need to crop it in a way that actually will help you bring attention to that. And so you can see the baby more. I mean, the baby's very cute and very engaging. The mother is still staring at you, but we got rid of the blue t-shirt. But, this is where then it's up to whoever is there, the communications officer, whoever, is to encourage the mom to look at what the health worker is doing, to help tell the mom to, see what is it that he's doing to your baby. And this way the mom will then look at that baby and then the picture will be much stronger. So timing is an element that best conveys the message. It could be anything, a chance of a couple walking down the street and the couple's looking at each other or holding hands. It could be even something like blades of grass swaying in the right direction, or the sun going down in the horizon. In journalism and in storytelling, timing is what we call the decisive moment. It's the peak moment of action that is going to go on. In filmmaking, it's the decisive moment. In still photography, it's when you watch something unfolding and it's the peak of that moment that will best tell the story. And that is what timing, or decisive moment, is what can turn just an okay photo into something that's pretty good. This is an example of that. I use this all the time. And here I composed a picture to frame a woman between two people and the door frame. I was sitting there, I was spending kind of time with this family. They were being checked for their HIV status, and they were having a health checkup. This was in Tanzania. And both this woman and her husband were HIV positive. And so, I mean, we took a lot of pictures there, them being checked by the doctor or whatever, you know, I mean, there was a lot of pictures out of this, but this is the picture I favor because I'm sitting there kind of watching her, and they keep opening up the door and I can keep seeing her. And so at one moment she looks up at the health worker, and her face has one of concern and a bit of worry. And I feel like that is the most impactful thing. And by framing her with the door and the other people's arms, it also speaks to her being contained in this life of HIV, being HIV positive. So finding the right picture is often like fishing. You find a spot that you think is good, and then you wait for it. You don't run around, like as my mom would say, like a chicken without its head. You actually sit and wait for photos to unfold. And if you're in a good situation, those things will just happen in front of you. And this is a picture again that was sent to me. This is not a good picture. And just even ignore the fact that it's blurred. Why would you even send a picture that's blurred? I don't know, but ignore that fact. The problem that I want to talk about here is the timing. There's a lot of things that is going wrong with this picture. First of all, there is a blue curtain that sort of separates physically the mom and the health worker. I'm sure the health worker is there to talk about how to take care of the baby or something. She looks like she has one of those information tablets in her hands. And so these people are not only physically apart, but they're actually emotionally apart. For some reason, the mom is looking off screen. I don't know why. And I think I know why. I've said I don't know why, but I know why, because there are other people in the room and they're all chit-chatting and she's listening to them. And then the health worker she was taken with a flash, and there's this big shadow against the wall, which is very distracting. But she's looking down at this program in front of her, or this little flip card in front of her, and she's not looking at the mom. So neither the mom nor the health worker are engaged with each other. So is this the message that you want to send? So this is something that you need to be concerned with. I see this all the time, and I'm going to show examples of my own work where people are looking off camera. And the reason why is because these rooms are often filled with not only the communications officer, but the program officer and the local guide and whatever. And they're chatting, you know, not thinking of what the photographer is trying to do. So my suggestion to that is, once the photographer is photographing a situation, get that group out of the room, because this way the person then who is the subject of the photo, the health worker and also the mom, can actually be talking to each other and not listening to what's going on with the other people in the room. And so there's a lot of reasons why timing doesn't work. And I'm going to show two bad examples of what I did. Successful timing requires careful observation. When people are not comfortable, you have to make them comfortable, which means you have to spend time with them. And oftentimes there's no emotion on a face. So is that what you want to show? You want to show no emotion? I don't think so, because you want to show that your program is successful. So this is a situation I did in Nigeria a couple of years back. It's about microeconomy, and these are women who are selling palm oil in their community to try to make money. These are all mothers. And this is, I think, the worker, or the health worker in green. Well, we just landed in this poor woman's backyard. There was no warning for her. She, of course, respected the health worker, so she cooperated with her. But you could see how uncomfortable she is. These are just pictures I take often immediately when I come into a scene. The health worker is looking at her, but she's looking down at her palm oil. And then when she even makes a sale, she's not looking at her client. She's looking down off to the side because she is very, very uncomfortable. And later we spent some time, about maybe 20, 30 minutes, talking to them, you know, trying to make them understand what we're doing, and which they did. They understood very well. The parents are very comfortable. This is another mom who's very comfortable. So the parents look great. They're, you know, interacting, but then they both have their own individual babies. Again, the same situation with the other picture. There was a group of people behind me talking. It was the health worker, it was a program person, it was a person we were traveling with, and it was even the driver. And so the babies are all looking at that because they're hearing that, and we could not fix the situation. I looked through my entire take and I could not find one where the baby was engaged with the parents. The babies were all looking off camera. So this is something where you want to ask that little, group of people who are with you to actually please move behind a house or move further down so that they're not distracting the baby. And this happens a lot. And I'll show you another example of this that was taken by another person. So here it is. The parents look great. The parents are very engaged, but the babies are looking off screen. And that does not make for a successful picture. This is another Nigerian situation. I did a lot of work in Nigeria. I love working in Nigeria. And here is this woman whose husband was asked, we need to get a picture. We want to emphasize dads, and their involvement in the program. So dad comes in, and the woman had just given birth the day before. And so they end up, the father comes in with the baby, and then the mom is looking straight ahead. And the reason why the mom is looking straight ahead, you can see she's looking straight ahead off screen. Let me tell you why. It's because we came into the room with very important people, not me, but it was the head nurse, the program officer, and a couple other people. And so the woman was actually worried and frightened that something was wrong. And so this is why you have to be very careful when you just sort of what I call parachute into a situation, to make sure that the families are very aware of what you're doing and they understand what you're doing before you bring the photographer into the room. Because this is what you're going to get. You're going to get a person who's very concerned and very worried that something might be happening that is not good. So this is after spending about, a few minutes explaining to them, we got this scene instead, which is really, really a nice scene. And the head nurse explained to the mom why we were there, what we were looking for. And then actually everyone left the room except for me. And because it's in Nigeria, these people do speak English. So I didn't even have to have a translator in the room. Mom is looking at dad, dad is looking at the baby. And there's actually a connection between this couple and this family. And then you can also see the baby very clearly. So it takes time to make people comfortable, and you have to explain things to them. You can't just, what I call, parachute into a situation, run from room to room and expect to get really good photos of individuals, of the people that you want to photograph, of the people that are benefiting from your programming. Your chances of making a better picture is to be able to spend time with these individuals and to be very clear about what you're doing. The other concern is, did you really capture the right picture? Again, because you can take a picture very easily. You can snap a bunch of pictures, and in your brain, you're thinking, oh, there must be a good one in there because I just took 10 photos. But my answer is, was there really? So anyway, the good work is that you have to, again, observe and watch. Grabbing a picture at the end of a meeting or between breaks from a program work is not really a good way to capture photography. Teams need to really either designate someone to take that photo in order to make photos that are going to capture an audience and inspire an audience. If you can't bring in a professional photographer, then designate someone in your team to do it. Someone that can wait around, understand what's going on, and actually watch how the scenes unfold. And this, I'm going to show you an example of that. And this also then begs for the question is, what are these photos going to be used for? If they're going to be used for just in-house newsletters, no problem to snap the photo and go. But if they're going to be used to explain a program to a larger audience outside of your office, then you need to be really focused on what it is that you want to say. And the people that you're photographing need to be engaged. So here I'm going to show you a situation where it took time to get this, the right photo, at least in my opinion, the right photo. This was a scene in an Ethiopian hospital. I walked into the room without a whole lot of knowledge of what was going on. So this is that sort of first picture you take sort of to set the scene and to sort of basically take the first picture. This woman just gave birth. This is the midwife nurse who's coming in afterwards to sort of follow up on the scene. The mother-in-law is in the background, and she is there to quote unquote support the daughter-in-law, but the daughter-in-law doesn't seem to want that support. And I must have taken about 50 pictures of this situation, and never did I see the daughter-in-law engage with the mother-in-law. So anyway, this is a second scene. Now, this would have been very acceptable where the nurse is actually helping the new mom with breastfeeding. But again, there's this picture of the mom-in-law in the background, and she looks kind of lost. So no, this is not a good picture. And then this one, the mother-in-law is trying to help, but the daughter-in-law basically gives her the shoulder, doesn't really want her to help. And you can see even the expression on her face has changed completely. So even though it's a nice composed picture, it is not emotionally the picture that I want to say about the situation. So the nurse recommends that mom-in-law sits next to the daughter-in-law, and let's do a group portrait, and maybe the dynamics would change a little more. But the daughter-in-law still gives her the shoulder. The mom-in-law looks kind of lost. And, so there's a lot of backstory here. I'd like to know what the home situation is about when I see these pictures, like, how is this situation at home? Because the daughter-in-law does not seem to care much for the mom-in-law, even though the mom-in-law seems generally like a nice person. So I can't seem to, there's a lot of backstory here. So what do I do? Finally, the mom-in-law picks up her stool and moves it to the back of the room. And I just kept standing there and kept watching the scene with my camera. Again, be like a fisherman, not like a hunter. And in a few moments, she actually looks over to the baby, and I grab that shot, and she has a nice expression on her face. So to me, that was the picture that finally works. Mom is engaged, mom-in-law is engaged. She looks good. The mother is good. She looks at the baby. And so you have the scene of mom, new baby, family with the mom-in-law. And so this is a picture in my book that works. It doesn't always happen that way. And sometimes the moment never occurs. But, if it doesn't, you just move on. But I was lucky. I have literally one frame of this picture. So I think as communicators, oftentimes we are told to tell a story in one picture only. So that picture has to carry a lot of weight, and there needs to be a lot of things going on in that picture. But again, it has to be also compositionally clean and easy to read. And so the picture has to be clear and no distracting clutter, because you have to get to the point very quickly when you're doing these one picture scenes. So I love this picture, maybe because I liked working with this guy. This was a midwife in Ethiopia. I'm going to show you a series of 4 photos that are very storytelling in their own right. This is very similar to the mother-in-law situation, where I had to just sit and wait for a while and take a lot of other pictures that I don't feel like was as strong in terms of telling the story of this midwife as I feel like this picture was. And also this is very good compositionally, and that there's a clean background. This is a male midwife in Ethiopia, and he delivered a baby of a mother who was brought to the center on a cart. It was sort of an emergency situation. And, so there's a whole scene where he's delivering the baby, et cetera, et cetera. But I love it after he cleans the cord off the baby, that he kind of lifts the baby up to see it. And I just love the expression on his face. The baby is lifted up high enough that it's clearing all the clutter in the background, and you can sort of see that there is this healthy baby in his arms. So that picture to me says a lot. And also, just as a detail, you can tell this is not a very rich place. I mean, there's a ripped up mat in the background. The towels look kind of ragged. The paint is chipping. So in the wall. So this midwife is doing a great job with very little income. This is a sort of similar situation in Guatemala. These young nurse midwives, who are all in green, were at this hospital to follow the nurses and to learn on the job. And this young woman, this 17-year-old girl, was brought in an emergency situation to deliver a baby. It just happened. We were there for I was there, and suddenly this woman just comes into the room, again, with the parents. So we had to get permission from the parents and all that kind of stuff. And it's a great situation that shows the nurse midwife students helping out with the head midwife, or the head nurse, which is the woman in blue. And then they are trying to transfer this woman onto another bed. The baby and mom are doing well. We're doing well, I should say, even though the woman looks a little distressed in her face. But what's interesting to me was this hospital was not on the original agenda. They did not have any intention to go to the hospital. Again, it was one of those things where, let's just photograph the nurse midwives and students in their classroom. So I asked to go to the hospital because I felt like that would be a great situation to get these midwives in training and to get the actual, already certified midwives doing the job that they need to do. And I have to say, I got a little bit of pushback on this one from the communications officer. She was a little annoyed by the request, but luckily, and this was Save the Children's communication officer, luckily the JPIGO representative understood that there was great value in this, and he facilitated this, and we were able to go there. This is kind of the issue when you have 2 different organizations all on the same trip. both with different agendas. So anyway, it seems to be sort of the common way that things go these days. But anyway, this particular image actually won a major photographic award with the Communications Arts program and in the institutional category. So Chapaigo's name was attached to this picture, and it got a lot of national attention. This other picture, this is the same visit that was only a different situation, where in Guatemala they're trying to improve the water quality of a village. This was something that the Chapaigo officer had recommended that I do. Again, it was in conflict with the Save the Children's person. So again, just something to think about. And the idea was that these women would, take this water. They were trying to filter this water up at the holding tank, but then also the women had to boil the water for safety's sake until they could get this figured out. There's a lot of information here. The boiling the water on the stove, the skinny dog shows how really impoverished this area is. But also for me, since I'm also looking at other things, the smoke coming off the stove is an issue with the health of these women who are cooking in these areas that are not ventilated very well. So this is a picture that had multiple things that people could talk about. Again, my last picture here with the, in terms of the segment, it's a feeding program in Guatemala. It's also at another time during the same visit. And these health workers would go in to help these parents cook nutritious food for their children. And they would bring in food and recipes and help the parents learn how to cook and help the parents in terms of feeding. I love this picture. The older brother is looking at the parents feeding these twins who are just so cute with their little matching hats and everything. And there's a lot of information in this picture. The twins look very healthy. They're obviously well taken care of, despite the fact that this is an impoverished situation. The dad is helping with the feeding, so the dad is involved. So this talks about men being involved with their families. And of course, the little male brother, the brother, is also involved and wants to help out too. So this is a very interesting kind of family portrait. And I don't know really how, I only stayed there for like a half a day, but I'm assuming that this was a very emotionally healthy family and that the parents did work together to try to raise their children. Sometimes telling a story has to be done in several photos, not just one. I'm going to talk about a situation in Indonesia with nurses and midwives, and only one of these stories was actually assigned. And when you want to do something that has multiple photos and you want it to come together and work together, this is when I recommend you bring in a professional, because it takes a skill set to do this. A program person is not trained to do that. A professional photographer is. And so, we're there to go in there and to see what's going on, to find what the story is, and then to hone in on the story and create a story arc. This takes training, this takes years of experience, and this also takes understanding of what your program is about. So it takes somebody who has been in the field working with this specifically for several years. This is, I was in Indonesia. I was lucky enough to get an assignment there because I was actually doing something else in Asia, and then I got rerouted to do something in Indonesia. It was really great working in Indonesia. I took hundreds and hundreds of photos. This is just a little collection of the photos that I took. But it was kind of an interesting situation there. The communications officer was fantastic. The program director was in another world, and visually, I should say. And his idea of photographing a good picture was to basically just line up the midwives and photograph them. All he wanted was just pictures of the nursing staff, which is fine. But in my opinion, you don't need to bring in a professional photographer to do that. That is something that can just be taken with an iPhone by someone else on the staff. We even ended up at this hospital, which actually had no patients, and other than this one that was set up for the photograph. This type of picture is not interesting, it's not engaging, and it looks fake. And when you're an NGO and you're trying to promote a programming, you don't want anything that looks fake, because then people are wondering what is going on here when they see the photo. So anyway, I decided to make the scene active. These are all the midwives, they're fantastic. And these women deserved it. So we did a series of group shots where I had them go through the exercise of a team meeting. And I asked them to just do what they do every morning before they go onto the floor. And it got to be really fun. I mean, the midwife and the head midwife and the head nurse they're the ones in the white and the brown outfits, and they were really going through this, but in kind of a nice light way, because it wasn't a serious meeting, which got everybody engaged and everyone's looking forward. And even compositionally, your focus goes to these two women. The women are wearing the same outfits, so those are the repeated patterns. And so this kind of situation kind of works as a group shot. And group shots are always required wherever you go. So the thing is that have fun with the group shots, work them, have them do them while they're working or while they're talking to each other. And if you're doing it for your newsletter, of course, you can line them up and photograph them. But those kind of pictures never are appealing to people outside of the immediate group. So if you're going to do it for a newsletter, fine. But if you're going to do it outside of your group, you need to make these pictures a little more engaging. And because they were having fun, and because, everyone understood what was going on, by the time we got to photographing the leadership, it was really easy. This is a really fun, engaging picture of the two head nurses that was also required. But these women are warm. They come through in a nice way. And also they required the signage in the back, like you do in a lot of these pictures. But if you have to do a sign, do it in a way that is not static. So, you can see that this is where it is. There's a sign in the back, but the two midwives in the foreground are very engaged. They're very animated, and they're just really wonderful women. And that's what you want to show when you're doing portraits of people. And again, it takes time. It takes time for them to get to know you, to understand what you're doing, and to work with these people to make them very comfortable. So we went to another hospital, and we had the same agenda to just do the nurses. And I immediately asked to follow the nurses in the field, so I could see what they were doing to get their amazing work. And this was in a hospital. So I wanted to follow them in the hospital. Again, there was a little bit of pushback on that, but luckily the communications officer saw the value of that, and she pushed for this. The nurses loved it. It gave them a chance to show the visitor their work. It told to them that they were, it confirmed to them that they were important, and that the visitor from the States wanted to photograph them. So it was a win-win all the way around. And all the patients, of course, were asked before I went into the room to see whether or not I could take the photo. And everyone seemed to be happy to have to be photographed. So these are the pictures some of the pictures that were taken of the nurses in the field. And it shows them engaged. The work, it's a much more impactful picture than just showing the midwives lined up against the wall. And of course, again, like I mentioned, we got releases from everyone. And this is, again, I'm going to mention this later, consent is really important to get everyone consented. It takes a little more work to do these kind of images. It does take more work. You have to arrange with the hospital. You have to arrange ahead of time with the patients. But the impact of these pictures are tenfold. People are going to look at pictures like this. They're not going to look at static meeting pictures. So it is worth the effort to sometimes do this kind of thing if you're trying to reach beyond your own office, if you want to go to a greater audience that is outside of the area in which you work. And this is a second story that I did on this particular shoot. And this was a story that was not assigned. But when I was working, I realized with the midwives, that they actually did home visits for follow-ups. Again, it was not in the original plan. And the local programming people did not think that it was important to photograph the story of the nurses following up with their clients. I thought it was very important because the clients are the bottom line. The reason why you train these midwives, the reason why you're giving them these skills is so that they can help the people in the community. So I felt like it was a very important story. And luckily, the communication officer in Indonesia also thought it was a very important story. And so she helped to set this up. I really love that communications officer. She's fabulous. And unfortunately, I guess she left a couple months later to go join her husband in Paris. But anyway, she set up this trip for the midwives to go to their homes. The family was delightful, and they were extremely happy that they had a midwife that was able to help with this delivery of a boy. So we started with her in the clinic, working with a patient. This is sort of a long form story. This is another patient that came in that was going into premature labor, and so they had to take her to the hospital. So the midwife had this range of work that she did. She worked in a clinic. Then also, once her work was done, she left. And it's always good to get these people outside because then it sometimes sets them in their environment. I think that's often missing. Oftentimes pictures are done in clinics, or they're done in hospitals, or done in offices, but all of these exist within a community and within an environment. And it's always important to get pictures within the environment too. So that's what I liked about her leaving her office. You could see the town that she worked in. And here she is on a motorbike going to the home to where she is going to be meeting this woman. And this poor young mom had lost 3 babies almost at full term. And so this is her 4th baby, and it was healthy and it's alive. And the proud, while she's being examined by the midwife, the proud father is holding the baby, and the proud grandpa, who is actually the father of the daughter, is looking on with great pride. In fact, I had a hard time getting this grandpa out of a lot of the photos. He kept wanting to be in all the photos. But anyway, and the couple, of course, is thrilled. They have a healthy baby. The baby is born alive, thriving, and they credit the midwife for this. So it was really important to me to show the impact of the midwife on these communities. And of course, she leaves and she's getting phone calls because her work is never done. So I have to say, just to be honest, the communications officer got a lot of pushback from the programming staff. They didn't feel it was necessary to go to the client's home. Basically, it was because of time. They thought that, they wanted to stay within a, 9 to 5 or 9 to 4 time frame, and we would go over that time frame. But luckily, she persisted, and we were able to go and spend some hours with this midwife. So the reward for this effort came in my opinion, was this piece was picked up very quickly by USAID to be one of their first visual stories in their inaugural visual storytelling website, which was launched in July of 2015. So I guess the lesson here is trust your visual communicators, trust the communication officer. If they say there's a story, then take time to follow it up. It's a risk. Sometimes these end up in dead ends. I mean, you can follow it up and it doesn't go anywhere. But in order to, do better and better storytelling, these risks have to be taken. Or it could dead end. I mean, that's just the risk you take. You don't get better unless you take a risk. So, and if you don't follow these threads, there's no reward. So that's just, and the reason why I'm saying this is because our brains actually are geared to process visuals. And USAID recognized this, which is why they created this visual storytelling website, because they realized that people respond to visuals better than they do to the word. So I'm going to close this down a little bit with a couple of pictures that were sent to me. I'm not going to talk about all of them, just a few of them on why composition is critical. These were all taken by staffers. I think these were all taken with a phone. So I want to talk about them. Many of them are very well composed. So that is not the issue for many of these pictures. But I want to just talk about this type of situation, which is what the Indonesian program person wanted me to do, and which we kind of managed to work around that a little bit. These lineup images with a sign in the background is very common. I see that all the time coming out of people's stuff. If it's for the newsletter and it's for an in-house publications or some sort of programming thing, it's fine. This is fine, but when you're trying to go outside of your office, go to an outside office, outside of your programming, this is not really fine, because people look at this and they're wondering what is going on here. Why was this picture taken, and what actually is the programming about? It actually lends to too many questions. So, and hopefully COVID will bypass us at some point. And so I can understand these people wearing masks because of COVID, but if they're wearing masks, then why do you line up? Because I can't see their face anyway. Get them while they're doing stuff, while they're actually working on the program that, they're actually being paid to be part of. So that is something, I feel like it takes, again, a little bit more work, but it's worth the effort visually. Now, this is one, it actually makes me laugh, but not in a good way. I'm looking at this photo when it was sent to me, and I'm like, why was this picture taken? I mean, like, what is this all about? Well, later I found out it's actually a picture of the biohazard suit that was sent to protect the workers against COVID. Well, if that's the case, then it should be taken in a way that actually highlights the suit and not the office behind the person. Again, the office, the person's underexposed, the lighting is really bright behind her. There's a lot of distracting items like the file cabinet, the plastic chairs, the palm in the window. So if you're really going to highlight the suit, then you need to put this person against a neutral background, like a white wall or something that will focus on the suit. The other thing is, and I realize this is, they were probably, trying to be a little bit lighthearted, but this is not for TikTok. This is not for Instagram. If you're sending this to Japago, this represents the program. And it also in some ways represents USAID. And in some ways it represents US taxpayers, because we're the ones who are funding USAID with our taxes. So you have to take this into consideration when you start submitting pictures that are kind of lighthearted like this. And also, if this is about COVID biohazard suits, just remember what a deadly disease COVID is, and that, other people have negatively been impacted by COVID. So that sort of thing needs to go through your mind whenever you submit pictures about this kind of stuff. The picture on the left-hand side was submitted. It's about cervical cancer checking, and actually compositionally it's not bad, except for the fact that it emphasizes the patient rather than the nurse that's in the background. And also another similar issue that happens all the time is that it was taken and the exposure was to the lighted area behind the nurse midwife, which means that the midwife is underexposed, or the nurse, and I can barely see her because she's underexposed. And also she's mostly covered by the blanket that is covering the patient. So when you're taking these kind of pictures, you have to think, what is the best angle and who is the focus of my picture? Is it the patient or is it the midwife? So luckily for me, I was able to take a similar situation where we had this nurse was doing a pap smear on this patient. And I managed to get up on a chair so I could have a better high angle so I could actually see the midwife, or I don't think she's the midwife, I think she's the nurse. And also see the expression on her face. She is engaged with the woman. She has a concerned look on her face. And she's taken a pap smear and you can't see anything that's actually bad. The woman has permission, gave permission to do this. In fact, I said, we won't show your face. And she goes, I don't care. So this woman is basically, she was in for having a picture taken. So anyway, I don't mind shooting into a light. I do that all the time. But when you shoot into a light, you have to make sure you lock down that exposure before you actually take the photograph. And you do that by pointing your picture, your phone or your camera towards the area that you want better exposed. And so that would be for this particular picture, it would be the patient or the midwife before you take the picture. And composition is, I'm bringing composition here. Composition doesn't always add to a picture. Composition is what doesn't add to a picture will take away from the picture. Now, this is a scene that's not bad. All the people are separated out. You can look at it, but my eye keeps going to that fan up in the ceiling. It's just too much. Why is that ceiling in this picture? It doesn't add to the picture. So I cropped it down, and it's a much better photo in terms of your eye then goes to the military officer, to the woman who's talking to them, and to the people who are in the background. So I feel like it's actually worth your budget to buy your people who have these phones and who you want to take pictures, to add a mobile photo processing app, such as a mobile Lightroom or mobile Photoshop or whatever, so that the staff can actually do a minimal amount of processing on images that they take, so they can have a much more major impact, and at least, if nothing more, crop down an image of a situation if they cannot get into the right position. Same thing. This was submitted as a vertical. It actually does better as a horizontal. Again, I cropped out the building. The building doesn't say anything. It's just a building, and there's, I guess, some overhead thing at the top. And so anyway, when you crop it down as a horizontal, then you can see the sign more clearly, and you can see more clearly the people who are behind the signs. So this is why cropping can sometimes help compositionally. These are a couple pictures from Guatemala that kind of bring together all the things that we were talking about in terms of distracted children. This is not a bad situation. The parents are actually very engaged, and compositionally it's actually pretty good. But with this one, the two little kids are looking off camera, and then the background is really overexposed. So with this other picture, I could tone down the background, but I can't move the picture, the gaze of his children. So this is where you need to have someone come in and engage the children so that they're looking forward. If they were looking forward, this would be a pretty good photo. And this is another thing. You can't see what's going on. The background is overexposed. The foreground is deeply underexposed, so you can't see what's going on. But when I opened it up, I actually loved this photo. It is compositionally great. It is, you know, all the moms are looking at this child, this girl in the middle looks like a dynamic little girl. But again, the exposure hit it. I couldn't see it. And so, you know, this wasn't a photo contest. If this had been properly exposed, I probably would have given it the first place award, because I just love this picture. I love what it says. I love everything about it. But I had to tone down the background, and I had to open up the people so that I could even see them. So this is where a mobile photo app would actually be useful, or any kind of, you know, a simple photo processing thing for your people in your office to basically be able to, you know, make these pictures a little more dynamic. I mean, I love this photo, but, you know, I couldn't see it until I opened it up myself. So the other last thing I want to a couple last things I want to talk about is providing picture information. This is always an issue. When you do photo information, you have to have what we call the 5 W's: who, what, where, when, and why. Who's going to benefit? What is going on? Why is this happening? When is this happening? And where is this happening? And plus, also, you have to get consent forms. And this is all really important because, again, the people who are looking at the stuff are not in your internal circle. They are outside of your organization. So they need to have all this information. They need to know why that photo is there. And so to conclude, these are some tips for mobile photos, mobile phone photos. You know, basically the same thing with composition and timing is the same, whether you're using a mobile phone or whether you're using a digital camera, it's the same. So there's not a whole lot in difference. The digital camera does give you some flexibility that you can change your lenses, and you can control the exposure, but composition and timing is the same, no matter what device you actually use. And so these are a few tips just in case you want to look at them. And again, even with the phone, you need to watch and look and see before you take the picture that you want to take. And that is actually recording what these people actually are doing. So, and I have one last comment on this thing. And if photography is an important part of your communication strategy, and then one needs to make the case to add money to their budget for photography. It is not an afterthought. It is part of your communication strategy. We are now more visually sophisticated as a group of people around the world. There are millions of images taken every day, and they're uploaded to the web. So an image has to work harder and harder to grab the attention of a viewer who normally spends less than a second to look at an image that doesn't grab them, that doesn't engage them. So viewers visuals will also define your company. If there's good images, then people will remember that. They'll remember, oh yeah, I saw that lovely photo online. If the images are bad, then the viewer will wonder how committed that company actually is to their programming, because they're not really thinking it's that important to record. And so, or how viable is that nonprofit that they're not spending any money to show them what their programming is all about. So these are sort of, you know, things. I know that the budget is a big issue here, but that's why you need to sort of think about adding that to your photography, and at least make the case for it that you need money for your photography, for nothing more than to buy better iPhones, better cameras, or put in photo processing, or hire professionals, one or the other. Because I'm going to end with this. These days, people don't read. They want to see. They want to see the program. They don't want to read about the program. No one's going to sit down and read 2 pages of copy, but they will look at a photo story or a handful of photos. So anyway, I'm very happy to answer any questions that you might have. And I think there is actually a ton of chats, and I don't know if any of them relate to me, but let's see what these chats are doing. Any questions?
Thank you so much, Karen, for taking us through such an exciting and captivating presentation. There are lots of comments and questions, but maybe we could give as we're trying to read the questions. Does anyone have would want to unmute themselves and just ask a question directly?
John, I posted mine there. Thank you.
And can you guys actually ask it, because there's 18 posts here and I'm having a hard time getting through them.
Okay.
This is like photography, you know, I mean, there's so much stuff here that it's hard to look at it. So could you just please ask the question? I mean, and then I can answer it, hopefully.
So mine was, I just wanted to like whether there's a list of no-nos, like things that you shouldn't do, because in clinical settings, like in the hospital, like where that woman was about to deliver, are there some things that you recommend or do not recommend in such settings? I struggle with what not to pick and what to take in a hospital situation. Thank you.
That's a very good question. And that is something that you have to ask the team that is you're working with about that. And I don't mean the programming team, I mean the hospital team, because they will know what is appropriate and what isn't appropriate. And they also know the patients, and they also know whether or not, you know, this will invade on whatever privacy they are. And so I always usually, you know, this is why I don't like parachuting into places. I like to just sit there and have a conversation with the hospital team and see what they are thinking, and also explain to them clearly what we're trying to do. And that is really important, that they understand. All the pictures that are very awkward looking were things that were just taken, you know, like, yo, we're just going to grab the shot and leave. I think when you hang around in a hospital more, and the patients and the parents of the patients, or the moms or the hospital and the nurses understand what you're there for, then they can ask. And I'm usually not in the room when the nurse is asking a patient if I can photograph them. And usually we're dealing with moms, so most of the people are actually, they're conscious. Because they're moms. they're not unconscious, they're conscious. And so and then the mom has a choice of saying yes or no. I mean, so, but without the foreigner in the room bothering them or putting pressure on them. I think, and that's, and I feel most of the times, unless it's a very serious situation, most moms don't mind. Like this little girl who came in, the 17-year-old, which brings up a lot of other questions why the 17-year-old was pregnant. But anyway, the 17-year-old that came in, her parents were there, and the nurses were able to ask her parents, because she was, you know, in the throes of hard labor, whether or not it was okay to photograph their daughter. And they signed off on the releases and everything. And that is one thing that is really critically important. They're consenting for, you know, and so so that is one of the things. And I think that's a really good question. And that's how I do it when I go into these situations. You know, very few, I can only even count on one hand anytime when they said, no, that would not be, it's not good. Mostly, once they understand what's going on, people do accept you to do it. And it's up to you not to photograph things that are embarrassing. I have done things like I've actually asked women, as asked a midwife to cover a woman who is naked in, you know, going through childbirth, because oftentimes in countries, women are naked when they're going through childbirth. I understand it's not that I want to change their habits, but I know for Chipago, that's not acceptable. So I'll ask them to cover them with a cloth while they're going through labor. And most of the midwives will do that, because you know that that's not appropriate. So for an audience outside of that area, and I've done that many times. So you just have to see what you think. And this is why it's good to hire a photographer who understands your program, who understands what it is that's acceptable and not acceptable. Because, you know, I know with the US audience, we don't want to see a lady buck naked giving birth. That's just not what's going to, you know, they're not going to find that attractive. So that's why it's good to then cover the patient, even though it's not what is normally done in that hospital. So those are just things. I think that's a great question, and it's something that you just need to keep asking all the time. But really, just I think the way you solve that is to have a conversation with the hospital staff before you go in terms of working. And you know, and other times the other time too is, you know, when you're local, they may not give you the permission that they might give to someone who's not local. And the reason that might be is because you have to then explain to them, these pictures are going outside of, you know, the area, to explain the programming and to help, you know, bring in more funding. And then that's something, then the nurse will understand that. And then they will say, oh, wow, okay, this is not just for your own personal portfolio. This is for something to talk about the programming outside of the area. So anyway, that's how I do it. So
Thank you so
thanks
much.
for the question. That was a great question.
Yeah, great question, Karen. And I just want to add, you know, you're absolutely right that, nudity is something that we're very particular about. But another thing, if I may just add to what Karen said, is that it's very important for us to make sure that what we are capturing, because, we usually capture things which are technical procedures, so the procedures are correct. So, we have to be mindful of that. We've not been able to use a ton of photographs, which are great, but it's just simply because the nurse is wearing a mask, which is either not worn correctly or the mask is under the person's nose. So just keeping those things in mind also, I would just add, are important when we are, capturing photographs, with some live action happening.
Yeah, and that's
Hello,
something
I want to, I am Suleiman from Burkina Faso. I ask something, it is related to project working on human subjects. Sometime there may be some of us will have to work on with this kind of project. I don't know if you have some advices to the team in terms of taking pictures related to projects that are working on human subject that maybe could help us to avoid some issues with donor, or I don't know, maybe if you have some ideas.
So if I may
Yeah.
just clarify, Suleiman, are you talking about human subject research, like people who are part of research?
Yes.
So, just a long story short, in JPIGO's policies, we are not allowed to take photographs of human subject research for communication. But Karen,
I don't
your
know what a
thoughts,
human
maybe.
subject research is, because I don't think I've ever done that. So what is that?
So human subject research, what Suleiman means is that if there's a cohort of people who are a part of a research study, then can we take photographs of them, and what is the process? But our policies are very, very clear on that we will not take photographs of human subject research. People who are a part of a research study will not be photographed.
You're talking about identifiable. You're talking about identifiable pictures of people.
Yes,
because you
yes,
can actually take pictures of people without identifying them. And so if that's important to you, if you need to have that photo, you just have to figure out ways in which to photograph that person without showing their identity. And that can be done. I mean, by moving behind them, I mean, just showing parts of, I don't know what it would be, a shot going into an arm without showing their face. I mean, there's all kinds of ways of doing that, but that just requires you moving around and thinking about how best to tell that story without identifying that person. And I do that a lot. I mean, I've done that a lot. I mean, not for JPIGO, but for other clients, where, it's a child and you don't want to identify the child, but, child's getting a vaccine or something, and or it's an HIV positive person. I mean, there's a lot of things that people may not want to be identified for, but they're willing to be photographed. I even just did something like that here in Richmond, Virginia, with a stressed African-American community. The woman wanted to, participate, but she didn't want to be identified. So she was always photographed from the back, and the program officer was photographed from the front. And so you could see him talking to her and his concerned look, engaging with her, but you couldn't identify her. So there are ways of doing that. If it's important to get a photo of that, I mean, since I never had to do that for you all, I don't know what that is, and what you're talking about. But I know that I have done photos of people, where I had to be careful about identifying them. So, and basically you just focus on the person who's delivering the service, not the person who's receiving it.
Yes, thank you. Thanks for that. It's a delicate topic right there. And especially because it's a research, and people have only consented to just participating in the research.
Yeah.
Yeah, I think the other one I was thinking about when you're talking about the 17-year-old, sometimes, and this is just also my experience, how do you handle not to being carried away in the moment? So lots of things are happening and you're wondering, should I take a photo? Should I stand aside? Should I step aside? How do you put your mind and yourself to to take the photo, but not be part of the emergency situation?
You don't get in the way, first of all. That's a big one.
Mm.
And you let them go, but this is where a trained photographer actually comes in, because this is something you're working fast, you're trying to compose while you're working. And this situation with the 17-year-old in Guatemala just came in like literally, we turned around and here she comes in through the door. I was doing something completely different. I was photographing the young students with their charges, the little babies that were in the neonatal clinic, neonatal sort of like these little warming tents and stuff like that. And all of a sudden there's this commotion, and everyone's looking toward the door, and here comes this girl coming in, on a stretcher, with I don't know if it's a stretcher on one of those tables, I guess, with her parents, with other people, and they're coming really quickly. And I was already got permission there. I already had permission to photograph all the nurses there. So, I was photographing it, it was going, and now I could run that picture if we didn't identify the girl. But I thought, okay, we have to identify her, because if you're photographing a birth, you're identifying the girl, right? And we did get a lot of birthing pictures, but that's when, the head nurse has to go to the parents and say, we have a visitor here, she's photographing, the work of the midwives. Is it okay to include your daughter? And then we also asked the woman, the girl, 17-year-old later, herself, if that was okay, because she was later, after she had recovered, after it was all over and she was fine and she had recovered. But those are things that you should take, because you can always throw those pictures away. It's like, if it's a bad situation or the person does not want to do it, you just eliminate those photos. It's not a big deal. That's what digital is just, it's a transitory medium. And so, but if you get something where it's an emergency and people have emotion, that's going to draw a public in. People are going to look at, oh, this is why you train your nurses. You train your nurses because they can operate quickly, because they know how to handle emergencies, because they know what to do when someone is literally appearing at the door about to drop a baby, and then you can put that woman on on a gurney really quickly, and the doctor comes in, the midwife comes in, or whatever, I think it was the midwife comes in, and they can handle this very quickly because they're well trained. And so that kind of thing is a message also you want to get out there. This is why we're paying for programming. This is why we're paying for education. This is why we're training these midwives. It's not so they can sit there and, do careful managed situations, but because you often have these life and death situations that are very critical, and you need to show that. This is why it's costing the cost. This is the cost of training these people well, is that the benefit of it all. And so these are the people who get impacted. And that's why I feel like it's really important to show patients or people in the field or people at home, because these are the people who are benefiting from it. It's not just the nursing staff, it's just not the hospital, but it's their patients. It's the people, who are receiving this care, that are being saved by these women and men, and that's why it's important to show that story, because that's what the American public relates to. If you're going to use these pictures outside of your own in-house publications, but you want to show them outside of the in-house publications, people relate to that kind of storytelling. They relate to the stories of individuals that are being helped by these programmings, not by the programming itself, but by the people who are impacted by it. And I can't even emphasize this. Everybody wants to do their programming. I can just be frankly blunt about it. People don't care about programming. They don't. The American public looks at programming and goes, oh, so what? But when they look at someone who's been impacted by programming, it's like, oh my God, that's amazing. This woman was saved by these nurse midwives. And these nurse midwives were the ones who were trained by your programming. So you don't have to be always specific about what you're photographing. You can do the end results of what you're photographing. And that's the bottom line, particularly for the American public. Now, if you're just doing it yourself, in-house, wherever you are, fine. But, in the American public, we're jaded. We need to see things that are a little more, storytelling, a little more engaging, a little more about human emotion. And that there is a backstory. People always like to hear the backstory. So that's also important to collect information when you're also photographing. And again, collecting, I just saw a thing from Cole, consent forms, important, because you can't package these things if you don't have consent forms. So you have to make sure that you have those. That's extremely important. Anybody else? Sorry,
I
can go on this whole trend on this one.
You know, we are well over time, but I have a quick question, and then I think Gasper has a question, and maybe Joanne, if you know, maybe we can stop after that if you know, unless. So, you know, I'll try to be very quick about my question. You know, there is this whole there's this whole wave of decolonization that's happening, and you know, especially in development work. Do you see any impact of that in the kind of photographs that you take, or with the clients that you've worked with? Have you seen that to be a topic of discussion in any way? Because, you know, many a times what you know, the narrative is that, you know, we are trying to sell poverty, we are trying to sell something which is, you know, that a country cannot be swept in only one shade. And so is, you know, this whole conversation, is this having in any ways being affected in your photographs, or in the kind of photographs you're being asked to take?
Not for me, because for me, I just try to photograph the human story, the human drama. Like, you know, that guy in Ethiopia holding up the baby, there's nothing about the conflict that's going on there in that photograph. It's just about somebody who's doing a job that he loves. All that other stuff about colonialization and all that, that is usually done in the words. And so it's up to your word communicators to be dealing with that situation. And part of it, maybe, this is why I don't like branding pictures. You know, people say, oh, we want to do brand. This is why I hate those sign pictures, the branding pictures, because then it looks like the white colonialists have come in and saved these people, you know. And my feeling is you don't need to do that kind of branding. If you want to do branding, the branding is in the work that you do. The branding is in the impact and the final results. And this is why the human stories are much more important. I mean, I did some work for Catholic Relief many years ago, and they had one communication officer wanted to put CRS in every single photo. And I'm like, really? Because talk about colonialism, you know, I mean, you're only there because the local villagers have allowed you to come in, are supporting your efforts, and are then, you know, I mean, it's not CRS who's saving them, it's the villagers themselves who are helping themselves, and CRS is just supporting that effort. So, I mean, I hope there's someone on CRS on this. Censor that with CRS. Okay, but anyway, it really annoyed me because I felt that it was very bad, and I refused to do it. And of course, you know, there was some pushback on that one, but you know, branding is only for in-house stuff and for maybe for your fundraisers, but you don't want to tell your story with it, because the story is about the people themselves, the nurses themselves who have managed to get their training, the doctors who've gotten their training because they feel like it's going to benefit their community. It doesn't matter where they got it, and then they are benefiting their community. That is the storyline that you have to stick with. To do anything else where you bring in Chipaigo's, you know, branding all over the place, that's where you start getting into trouble with colonialization. And that's where you have to be very careful about that. And, you know, and I know this happens all the time because everybody wants pictures for their funders, and that's fine. You tell the photographer, whoever it is, hopefully it's me one day, but you tell them that, you know, okay, get some branding pictures, but we're using them specifically for fundraisers, but not the stories that are going into USAID's website, or not the stories that are going into, you know, the New York Times or whatever it is, you know, because, you know, now you have an opportunity now to package a whole story for the New York Times. That's fantastic. I mean, you had Trevor Noah talking about Chipaigo, you know, on his comedy show. That's amazing. But, you know, you don't want to talk about that stuff as though you guys are the ones who are in saving these people. That's really not amazing. That's terrible. So And so, I mean, that's my opinion. You know, that's after doing this for 30 or 40 years and realizing that if you act like a colonialist, the minute you leave the program, the people haven't bought into it and they just stop doing what you ask them to do. So the whole thing is to actually try to get everyone engaged and have it come from the community, and it's community-based efforts, and they're buying into that.
Thanks so much, Karen.
Long answer for a short question. Sorry.
Gaspar, please go ahead.
Yeah, good afternoon. Sorry, this is not Gaspar, this is Bengali. I'm using Gaspar account. In my mind, what I believe, the devices that we use to capture photo also have an impact in terms of improving the qualities of the photo that we're going to take in terms of the color and other features. So what I want to ask what are those devices that you could recommend in terms of phones or camera that can produce best quality for photography? Yes. Do you have any?
Yeah. Yeah, I have a question. I have
Yeah.
the best quality of a photo. I mean, I know this sounds like I'm trying to avoid the question, but I'm not. It begins in your head, which means you have to understand what you're photographing in order to improve that quality. And right now, iPhones are so, I say iPhones, that's because that's what I have, but smartphones are so smart that you can use a smartphone and get pretty good quality pictures if you are in your brain, looking through the camera and only capturing what it is that you want to capture, and you're aware of all of the other sort of things that are in that picture that may not be adding to the messaging, and that you need to then get rid of that stuff by moving your body, going up and down or whatever, or even moving the subject if you have to. The digital cameras are equally as good. I mean, you're not making 16 by 20. I mean, maybe they're posters, but most of what you photograph is going to be on a document or going to be online. So you don't need to have these 50 megapixel images. You can do with what you see in a normal digital camera that most people can afford. And almost all the digital cameras are kind of the same. So again, it's in your head first. What is it that you're trying to say? And then what is it that you want the camera to see? And then you kind of work from there. If it means, if you only have a smartphone, you move your body around to until you can see what you want to see. If you have a camera and you can change your lenses, you might change it to a wide or a long lens or whatever, just to kind of bring in carefully what you want to see. But this stuff takes practice. It's not something I can just say, oh, go out your camera and take this picture. It takes practice of looking, seeing, observing, and then working with your tool, whatever your tool is, whether it's an iPhone or a smartphone or an Android, or whether it's a digital camera. Whatever it is that you have, you have to be familiar with your tool and what your tool can do. And that's all it is. It's kind of like writing. If you have a bunch of words, your pen can be a tool for change, or can be just be a tool for gibberish, depending upon how you use your pen. And the camera is the same way. It can be a tool for change, or it can be a tool for just like throwaway images. And again, so it all has to do with who you are and what you're thinking and what you want to say, and then trying to get your tool to do what you want it to do. And that's what it is. The coloring impact and all that has to do with exposure. It has to do with lighting. We don't have time in this seminar to do that, or webinar. I mean, I feel like things like that are best done in person, because then you can kind of go over all this and look at what people do and then talk to them, about it. I do these kind of not webinars, but I do sort of these kind of workshops all the time. And it's hard to explain that to people, even using my own example. You have to kind of use their example of what they've done and how they can, how they can improve what they've done, so that kind of thing. So it's not exactly a direct answer that you to what you asked, but there really isn't no one tool that I would recommend. It's all about just being familiar with the tools that you have, and then knowing what it is that you want to photograph and what is this message that you want to say.
Mm-hmm. Thank you so much. I know we have just about 4 minutes before our time slot closes, but thank you so much, Karen, for sharing your experience. And gosh, it's been really insightful even for myself, just opening my eyes, like Vera said, just being able to look at pictures differently. I wonder if there's a way we could reach out to you, maybe through email. Maybe you could share your email on the chat box, Karen, and then maybe guys could reach out to you just in case they have further questions or would want to engage with you further. Colleagues, thank you so much for joining. I know we've gone way beyond our time slot, but I think it was worthwhile. Thanks so much for joining. I think the other agenda points that we had was the GECO report is going to be shared soon. It's being compiled. It's going to be shared soon. I think one of the things that we've been working on is doing a survey. So look out for a survey, because we want to ask whether the standards are applicable or useful, and then how we could maybe change them for the coming year. So look out for that email with the survey. And I know Karen will also share her presentation, because there's that ask on the chats for the presentation. So thanks everybody, and have a lovely morning, a lovely afternoon, a lovely day, or a lovely evening.
Thanks, everybody.
Bye-bye. Thank
Bye.
you.
Thank you.
Bye, everyone.
Thank you, everyone.
Bye.
And thank you, Karen.
Thank you.